This is our air fracture walker, walking boot, cam boot. You may hear your provider call it different things. Basically, it's for mobilization of severe tendon injuries. Our post-op patients get one of these boots or for any fractures. I'm gonna show you how to apply it. So you wanna make sure everything's open. The Velcro, the straps, everything is open for your foot and leg to slide in there. When you do get your foot in, you want to make sure your heel is comfortably close enough to the back of this frame to where you're not feeling any discomfort or pressure, but it is far enough back to where your toes are not coming out the front. You have the liner to start with. You want to close it in at the toes and then close this in at the leg. All of this Velcros together and you can place it to your comfort level. Next is the straps. I would always start with the toes first. So this strap has a loop on the opposite side and you're just gonna pull that through, tighten this up again to your comfort level to where it's not putting too much pressure on the foot and then closing that over. And then just repeat this process until you get all of the straps closed together. This is one of our short boots. We do have a taller boot that actually extends above the ankle a little further. So it does have 2 more straps that actually comes up, which brings this up almost to the knee. A lot of patients usually like this boot because it's shorter, it's less heavy, more comfortable to wear. Once you have this boot on, you have a bulb on the front that actually inflates the air bladder, which is usually on the back part of the foot. You want to pump this until it's comfortably snug. When I say that, just making sure that when you lift your foot off the floor, that the boot feels like it's holding onto your foot. When you're walking, you don't want too much shifting of your foot as well. So you just want to pump this bulb until it's comfortable for you. Once you have it to the tightness that you like, you will keep it like that and wear that throughout the day. Typically, you do not have to wear it to bed at night. Some of our providers may have our post-op patients wear this at night. If that is the case, they will instruct you to do so. You can wear this with or without a sock. You may be more comfortable wearing it with a sock. That's totally up to you. Removing this boot, now that you've got this inflated, you want to deflate this. This little button up front has a cap. So you're just gonna flip that cap open and you will see a gold button there. You're gonna hold this button down until you hear all the air has deflated from the boot. Once you hear that happen, just close that cap back up and then you can start removing your straps. Again, I like to always start at the foot, and if you close each strap over to itself, you won't have the entanglement of these straps connecting to each other.